Hello everyone. So we are back with this series of previous year question with topic discussion, and in this video I'll discuss questions from rheumatology. So what I have observed is there were 6 questions from rheumatology in last 3 years, and all of those were clinical questions. In this video I'll discuss 3 questions, and in the next video I'll discuss 3 more questions. So from these 2 videos we'll cover rheumatology. Okay. What I have observed is कि hematology से क्वेश्चन जो आए हैं वो लॉन्ग क्वेश्चन थे, क्लिनिकल क्वेश्चन थे, एंड द गुड थिंग अबाउट देम इज कि सारे क्वेश्चन में बहुत सारे हिंट्स थे. ओके, सो वन लाइनर्स क्वेश्चन नहीं थे, एंड दैट इज अ गुड थिंग फॉर अस. ओके, सो लॉन्ग क्वेश्चन में द बेनिफिट इज कि आपको इतने सारे हिंट्स मिल जाते हैं कि आप डेफिनेटली डायग्नोसिस तक पहुंच सकते हो. ओके, so this is the first question. The question states that a 26-year-old female came with the complaints of pain in the forearm, transient loss of vision, and abdominal pain. Femoral pulses were weak. What is the most likely diagnosis? The question says that the patient is having pain in the forearm. Pain in the forearm अगर हो रहा है, forearm means elbow से नीचे. Okay, वहां पेन हो रहा है मतलब या तो रेडियल आर्टरी में दिक्कत है या अल्नर में. क्लियर. ट्रांजिएंट लॉस ऑफ विजन मतलब आईज की आर्टरीज में गई या फिर टेम्पोरल आर्टरी गई. And abdominal pain. Abdominal pain means mesenteric artery involvement. Femoral pulses were weak means या तो abdominal aorta में दिक्कत है या femoral artery में दिक्कत. Clear? So all these are giving a clue that large vessels are involved. Okay. Now, as we know, PAN is a medium vessel vasculitis. Thromboangiitis obliterans is another name for Burgess disease. Takayasu arteritis is a large vessel vasculitis, and microscopic cholangitis is a small vessel vasculitis. तो अगर हमें बस इतना क्लासिफिकेशन भी पता है, then we'll come to a diagnosis that the answer is Takayasu arteritis. Also, patient is a 26-year female. Takayasu generally occur in patients of less than 40 years of age, and the ratio of female to male is 9:1. It is more predominant in females. Let us come to the next question. A woman presents with numbness of fingertips. On examination, her face is tightened. ANA is positive and immunofluorescence is showing nuclear pattern. What is the most likely diagnosis? The patient is having numbness of fingertips. So it means the patient is having Raynaud's phenomenon. Yeah. Examination by face is tightened. Okay. And ANA is positive and IF is showing nuclear pattern. So all these are pointing towards systemic sclerosis. Skin involvement plus Raynaud's phenomenon. Okay. Systemic sclerosis. Systemic sclerosis can be of two types. One is CREST syndrome, another one is diffuse scleroderma. CREST syndrome में the antibody that is most commonly seen is anti-centromere antibody, while in diffuse scleroderma we have anti-topo isomerase antibody or anti-SCL70 antibody. Yeah. Sjogren syndrome antibodies anti-Rho and anti-La. For SLE antibodies are anti-dsDNA, anti-Smith. If it is a drug-induced lupus, then anti-histone. Clear? For RA, we have rheumatic factor and anti-CCP. क्लियर. सो अगर पेशेंट को शॉगरेंस होता तो सिम्टम्स क्या होते हैं? ड्राइनेस ऑफ माउथ, ड्राइनेस ऑफ आईज, रीनल इन्वॉल्वमेंट, आरटीए. ओके. पेशेंट को एसएलई होता तो सिम्टम्स क्या होते हैं? रैश, मेलार रैश, रीनल इन्वॉल्वमेंट. रूमेटॉइड आर्थराइटिस में द सिम्टम्स वुड बी लार्ज जॉइंट में पेन, स्पेशली नी जॉइंट, फिंगर जॉइंट्स, स्पेयरिंग द डीआईपी. Third question is a patient with GCA presented with headache, jaw claudication, polymyalgia rheumatica, and mononeuritis multiplex. What is the first line of treatment? So they have given us a diagnosis that the patient is having GCA and having symptoms. So that means active disease is there. Okay? तो rheumatological disease में क्या होता है ना, अगर disease activity कम हो जाती है तो we stop treatment. Now they are pointing that active disease is there. Now what is the first line of treatment? First line of treatment is steroids. Any rheumatological disease, first line of treatment is always steroids. Now, what is the second line of treatment in GCA? It is tocilizumab. It is second line, first line is steroids. So the answer is steroids. Now, what is abatacept? Abatacept is a co-stimulator inhibitor. Okay. What is tocilizumab? Tocilizumab is a IL-6 inhibitor. Okay. All the best, guys. In the next class, we'll discuss the remaining three questions of rheumatology. All the very best.